Welcome to the Digital Connected Care Coalition and UHC 2030 Digital Health Series webinar. This is the first of 3 sessions and will focus on collaborating for digital health and better care. We will be starting this session in about 30 seconds and waiting for audience to join. Welcome again to the Digital Connected Care Coalition and UHC 2030 Digital Health Series webinar. This is the first of 3 sessions, and this session will focus on collaborating for digital health and better care. We are just beginning the session, and for those of you who have signed on, this session is available in Spanish. So there is an interpretation button on the bottom right-hand side of your screen. If you require translation, please do change that to Spanish. This session will also be recorded. So good morning, good afternoon, good evening to all of our panelists and participants joining from around the world. It's my pleasure to welcome you to this exciting roundtable session where we'll discuss the challenges and opportunities for scaling inclusive digital health tools. We will cover what has worked and what can be improved. And we'll look into the role of the private sector and how we can better align public and private incentives to leverage digital innovations for a united effort. My name is Desta Lagal, and I am the Group Director of Partnerships and External Affairs at Amref Health Africa, based in Nairobi, Kenya. I will be moderating today's high-level panel discussion on the private sector's involvement in digital health. Our goal today is really to have a look at the role several parties can play. I believe in partnerships. That's what I do for a living, and want to really discuss how these different parties can leverage each other's strengths. Digital health, as many of you know, is seen as a great tool to advance healthcare and accelerate our journey towards universal health coverage by 2030. But we also know that no single sector, not the government alone, not the NGOs, and not the private sector can do this on their own. So we do need to collaborate. That's the main topic of the 3 connected webinars that UHC 2030 and DCCC have organized for this week. It's my great pleasure to welcome you to the first of the series. We have a great panel lined up and well positioned to discuss these questions. But before we invite our panelists to speak, I'd like to really ask you to give your attention for a statement from some of those who stand to gain most by the well-functioning and optimized healthcare system, and those are the future generation of leaders.
My name is Richard Mauto Jikunu. I'm from Ghana, but I currently live and work in Brussels. On a daily basis, this is my life. I work from home as a youth officer for the Young Aspect Tech for Health, supporting the young aspect from this small location of mine.
Hi everyone, my name is Danielle Mullings and I'm from Kingston, Jamaica. I'm the Region of the Americas representative on the Young Experts in Tech for Health, as well as the Partnership and Campaigns Officer for Transform Health.
So when I think of the future of healthcare, some of the major challenges which we even face now is the issue of access to healthcare and the cost in accessing healthcare. In a lot of developing countries, there are challenges with people being able to access physical infrastructure when it comes to health facilities or the absence of medical, workers. And where there is access, sometimes the cost is too much for people to bear.
What I want to see here in Jamaica is, one, more patient management systems. I think that's a weakness that our healthcare system has, especially as it relates to, like long waiting times and, forgetting which patient came first or second, etc. So I think that would really help us, as well as maybe even implementing some artificial intelligence that can automatically check, maybe do a pre-diagnosis, and then be able to sort the patients in terms of priority and who needs to be accessing the doctor first.
And when it comes to who is best placed to implement digital healthcare, everyone has a role. Government has the ultimate responsibility to provide digital infrastructure that can provide internet access for everyone to be able to access digital health technologies. But healthcare providers also have the responsibility to also teach the end users how to use some of these technologies. So in the end, it is a joint effort, government providing the critical infrastructure and ensuring that there are regulations to safeguard data privacy, but also health workers making sure that they provide the critical skills and capacity for the end users to benefit from digital health technologies.
It definitely, without a doubt, has to be a joint effort. And not even just the government and providers and private sector, but civil society. Everybody really has to get involved in this digital health move. And one level of it is going to be digital literacy. And so we have to start with, is the infrastructure to be able to facilitate this even in place? Do we have adequate access to internet, access to devices, or even the digital literacy to understand how to use these devices? Then we can look at what are the other layers we can now put on top of this, such as digital health, using it to access healthcare services, or even other realms of society like education. So definitely it has to be a joint effort in order to it to be fruitful and for it to get the requisite level of uptake that we need.
Thank you so much. Hearing Richard and Danielle speak, we're reminded that technology has a big role in shaping the future of primary care, and certainly in our ability to reach UHC 2030. And they raise some critical things, largely things that are our responsibility now as we hand over the baton to the future leaders in healthcare. And some of these things I hope we'll cover today in our discussion. And that includes improving digital infrastructure, data privacy, building capacity of health workforce to use technology, providing digital literacy to our end users, prioritizing care using digital technology, and then streamlining health delivery to ensure better access to healthcare for all and certainly better outcomes in all of our journey to healthcare. All of this speaks to improving partnerships and collaboration across all sectors. I see that there is a question in the chat asking if this session is being recorded. This session will be recorded and we'll more than likely share this with all of our listeners as well. I'm really delighted actually today that we have a phenomenal panel of experts joining us. I'll introduce each speaker and ask them to make some introductory remarks before we get into discussion. Our speakers today are Marilise Gurgens Prestige, who's the Health Innovation Lead at World Bank. We have Dr. Anthony Odofo Ofosu, who's the Deputy Director General of the Ghana Health Service. We have Jan Willem Schikron, who is the Global Head of Government and Public Affairs of Royal Philips. And we have Niti Paul, who is a Senior Advisor, Digital Health of AXA. So I'd like to go around the room very quickly and ask each panelist to share a short opening statement before we get to specific questions. To our speakers, I'd appreciate it if you could keep these statements to about 2 minutes each to leave room for some discussion. And because of our limited time today, I'll also ask the panelists to respond to audience questions in the Q&A or chat group, which are directed to them very specifically. So let me start with Marilise. Marilise, if you can just give us, a few words, context around this subject matter. Thank you.
Esther, thank you very much. I have the honor today to not just be a panelist, but also on behalf of UHC 2030, which is a multi-stakeholder global platform to advocate for universal health coverage, to welcome my co-panelists, the organizers, as well as the attendees, the participants to the session today. UHC 2030 is a unique platform that brings together all the different constituencies that Desta just referred to connect, work together, and influence national and international commitments for universal health coverage. These different stakeholders and partners include countries, low, middle, and high-income countries, civil society, represented by the Civil Society Engagement Mechanism with more than 1,000 member organizations, multilateral organizations, foundations, and of course, the private sector. UHC 2030 is co-convened by the WHO, the World Bank, and OECD. So on behalf of all of them, welcome to the session today. This session during Digital Health Week, in this session today, we're discussing private sector-led innovations to help with access to quality health services. We know, and we've all experienced, how digital health interventions have helped countries, communities, ourselves to respond to the COVID pandemic and maintain essential health services that will be important for resilient health systems moving forward. I think it is most important, and we will discuss today, how we can move all the many discussions, papers, reports, webinars about digital health, about artificial intelligence, how we can move that conversation from hype and hope to hands-on solutions. To do that, I think we're going to need new kinds of private-public partnerships, some of which we will be discussing in the conversation this morning. We will also need more evidence to really know what works and help countries make smart decisions about which constellation of digital health interventions would work best for their communities, for their context, and how it can add most value. I think as we have these conversations about digital health, we need to reimagine how health services are delivered, what kind of services are delivered, who delivers those services. And most importantly, we have to focus on the value that digital health in a transformed healthcare system can bring to clients who may not currently access health services, to patients who are currently accessing those services, and to providers, so that we all gain the benefit from the potential and the promise of digital health. Thank you.
Thank you so much, Marilise. Very interesting, moving from hype and hope to hands-on solutions. So thank you so much. Dr. Anthony, can I come to you? Unmute yourself, please.
Yeah, thank you very much. Yes, and thank you for having me on the panel. Yes, from my perspective, I mean, universal health coverage looks at ensuring that people have access to quality care, and then, I mean, and it being affordable, or they're not paying at the point of care. And this is where digital health technologies bring in a lot of, I mean, hope and promise, because the geographical access can be resolved, I mean, easily by using some of the technologies available. Telemedicine, for example, I mean, and quality care can also be, I mean, improved through using some of the transmissions of like digital x-rays, laboratory support. All those things are very critical going forward. And I think that's where health technologies or digital health technologies can be very useful and fast track access to quality care for a lot of people. Specialist care in most of our parts in Ghana is a problem, and it can be facilitated easily using digital health. The private sector has a key role to play in this, in the sense that they can bring in extra financing to support what needs to be done in terms of infrastructure layout, which is critical. They can also bring in innovations so that, I mean, the public sector can just pay for the service that they provide rather than investing in technology. or the hardware. So, it's a partnership. And I think going forward, that is the way it should be looked at, that together we can leverage all that is in health technologies to facilitate access to quality care for our populations. Over. Thank you.
Thank you so much, Anthony. Absolutely true. Working together and leveraging all of our skills and our strengths are important. So thank you so much. Jan Willem, over to you. To unmute yourself.
Thank you. I'll still do that. Thanks for the invitation to this panel. Let me just remind everybody at what pivotal point we are in the digital transformation of healthcare, and why now and not in 3 years' time. Then it's too late. Before COVID, the healthcare sector was already the last sector to go digital, and the promise of digitization was something that was being spoken about for like a decade and not delivered upon, not in Africa, not in Europe, not in the United States. So then COVID came along and left us no other option than to provide safe healthcare or affordable healthcare or access to care digitally. We've seen it with telehealth, we've seen it with consumer apps, we've seen it with the digitization of care in the hospitals, where typically you have about 600 applications running in parallel. And we've seen it in the onset of artificial intelligence. And now in the recovery after COVID, I'm still talking about the whole world, most of the healthcare systems are going to get an injection of digital aid. So we're going to see, for example, in Germany, that 70% of all the money invested in healthcare in the next 3 years is going to be on digital. We've seen in Europe 20-30% on average of which in healthcare, like sometimes up to 60-70%. In the United States, it's the same. So where does this leave us in global health? A lot of low and middle income countries are not investing in the digitization of healthcare. But I'm convinced that if we are going to achieve UHC, it's only going to be if it's digital. Now, the acceleration in the developing countries is there, but it's not in the same level as Europe and the United States. The consequence is the digital divide is widening and deepening. The LMICs are going to be increasingly left behind as Europe, the United States, and China are speeding up. So how do we overcome that? How do we actually make sure that the gap is not widening? And the whole point was closing the gap, not widening the gap. How do we make sure that this digitization is actually helping us to close the gap? Now, that is one of the areas where the Digital Connected Care Coalition comes in. And as Philips, we've said, we can't do this alone. Pharmac says, and Ahmed have said, oh, we can't do this alone. The World Bank said, we can't do this alone. And government said, we can't do this alone. Indeed. So we need to team up in a smart way. And the Digital Connected Care Coalition is a group of a global coalition of willing organizations, institutes, NGOs, foundations, international organizations, and private sector that are committed to achieving UHC through digital transformation of healthcare. And we're combining our efforts to actually see how can we overcome some of the policy challenges that LMICs have, some of the infrastructural challenges that we have, the problem that there's no viable business model to invest in. So how do we crowd in everybody so that there's a business model to make this sustainable? And finally, avoid the fragmentation that has killed the digitization for the last 10 years before COVID. Don't fall into the fragmentation trap, because scale and replication is the name of the game. And therein lies the opportunity. Copy and paste well. A lot of companies have grown really, really successfully, and a lot of companies and countries have grown towards UHC by copying and pasting. Thank you.
Thank you, Jan Willem. Very good points that you've raised here. And I think, especially sitting here in Kenya, the issue of the LMIC not investing in digital health as the North is quite a concern. So thank you so much. Niti, maybe I can just open the floor to you for a few comments.
Thank you, Desta. I hope you guys can hear me. So I'm the rather old lady on this call. I've been a primary care doctor for over 35 years in an inner city practice in the UK, but 13 years ago, I went off on my digital healthcare journey. to India and other low and middle income countries. So, and this is my sweet spot because I do also do UHC for a living, and here I work with AXA as a senior digital health advisor. So thank you so much for inviting me. So, we heard in the clip just gone, we heard the story around access and affordability. But I'm just going to flip it on its head, and I'm going to take a consumer perspective, and why this promise needs to hold true is the consumer perspective is in every country I've worked in, 40 countries and counting up to date, has been around it's trust, empathy, expertise, and information, 4 things that consumers are looking for. And in the expertise and information space, consumers are saying, I want to get the best possible information about health for my family. I want to know how to navigate it, which is what the second clip said. Your young leaders talked about the navigation of the consumer. I want to be able to find the best healthcare, and I want some means to pay for it. How do I pay for it? And that is the affordability issue that every consumer that I've met in my last 13 years of journey across 40 countries has told me. And so I'm going to just going to give you a little example. And I loved, Marilise, your statement around hype and hope and moving to real stuff. So we tried to do this in AXA as the pandemic hit. And I can remember I was in Spain at the time, and we were starting to do some of this digital healthcare bundled with insurance. And I'd done this in Bangladesh with a product called Tonic with Telenor. By the way, 17 million consumers are using it, and Muhammad Yunus has incorporated it in Grameen Kalyan. So big success story around insurance and digital health being bundled. And I can remember someone from Thailand, one of my colleagues from Thailand, saying, oh, we're going to have to stop. I said, absolutely not. This is the time to accelerate, because this is the time everyone's going to need us for healthcare in all sorts of things. So we did 8 pilots across 8 different countries. And I'm sure I can't share all of them now, but there's a couple of things that stands out. So we bundled mass market insurance, simple products like hospital cash or critical illness cover or life cover, bundled it with distributors who were doing this. So in Egypt, we bundled with a telco, in Brazil with a retail chain of shops, in Mexico with Uber, and in Thailand with a bank, and in Indonesia with another digital health provider which already had consumers. And we could then started, because I work for the financial inclusion arm of AXA. So the financial inclusion, health inclusion for me goes hand in hand, because the 2 things don't work separately. And we found huge successes, but lots of lessons learned about what works for a payer. And then just flipping that to the UHC, and then I'll stop. On the UHC side, we talked about good quality healthcare that every citizen of the world deserves to get. And I've found new click and brick models. This is something I coined during the pandemic. It's that seamless transaction between the click and the brick, and those brick models are evolving. New providers of healthcare are wandering in. These are the low-cost healthcare models. There's the company I work with called Seva Mobile in India. Their brick model is very different from what it used to be. And these new providers of healthcare is who will define how healthcare is delivered for the future. And I'll stop there.
Thank you, Nidhi. Thank you, Nidhi. A lot of things to think about. Certainly, I truly appreciate that. And good and interesting pilots. We'd love to hear a little bit more about that. Let me go around the room, and Marilise, I'll start with you. And thank you all our speakers for giving us a little brief information. Let me start with you, Marilise. What lessons have we learned from the pandemic around the importance of digital health and data for UHC? And then on the second half of it, Marilise, maybe you could just comment a little bit on if COVID has brought accelerated acceptance of mobile and digital health solutions. Marilise, we can't hear you.
Great questions. Thanks very much, Desta. Excellent. Can you hear me now?
Absolutely.
Great. So great. Thanks, and great questions. I think that we've definitely learned important lessons through COVID. And I think the first one is just one of necessity. I think that when countries didn't have a choice, they had to innovate and change their health systems, because if they didn't, people would lose access to essential health services. So whether it was whether it was from, the most basic of longer medication prescription timelines, for example, for stable diabetic or stable HIV clients, to all the way to the more high-tech solutions of contact tracing, digital solutions for COVID diagnostics and so on. Two, I think, which is what is by far been the biggest revelation of what is possible and how quickly it is feasible to stand up a telemedicine service. I think we've been astounded by just the scale and volume of telemedicine services. I think there are also challenges. There are challenges with regards to governance, data governance in telemedicine services. There are regulatory challenges, particularly for cross-border provision of telemedicine services. And so I do think that moving forward, we need to address those challenges. We saw the same with Ebola a few years ago, where there was an explosion of digital health solutions that were then not always followed through when the pandemic wave calmed down. I think what has changed with COVID is because the pandemic is global, some of these solutions have been global, and I think we've created expectations with customers and expectations with clients, as Niti said, that there are different ways of delivering healthcare. And I think it's those expectations, that demand from clients, that will drive the innovations to stick, to become scaled solutions, as Jan Willem said in his comments. And I think if we can't do that, we will miss a huge opportunity to change the way in which healthcare gets delivered, who delivers it, and how it is delivered. There are some studies that suggest that up to 40% of people who access primary healthcare clinics go there to get basic health promotion, health information that they could have picked up in 2 seconds with a Google search or a search of a reputable website. But think about diabetes. There are over 13,000 diabetes applications on the Google Play Store or the App Store. How do you know? How, as a client, do I know which of those I can trust, right? So it comes back to equity, value, and trust. And I think if we want to be successful in digital health, we have to focus on those 3 things: equity, value, and trust. And then
very loudly heard, very loudly heard. I'm going to move on very quickly. I'll come back to you, Marelise. I want to come down to Anthony now, because Anthony, you talked about telemedicine and the importance of it. And now I see that Marelise is talking about the regulatory challenges also around telemedicine. So let me ask you this question. To create an enabling environment in which digital innovations and companies can thrive, what are some of how do you think governments can find the right balance at the policy and regulatory levels?
Yeah, thank you very much. I think one of the key roles of government is the policy and regulation around digital health. And this should take into consideration the protection of the rights of the individual, privacy, confidentiality of the data, and all that. That is government business, and government need to do this. And then also government needs to provide some of the basic infrastructure that will enable this to be done in a way that is inclusive of all, of all the players, especially the private players. But increasingly, because when you look at it, the private sector, especially those who are private companies, they are in for the profits. So if you do not put in the right regulation and the right policies, then of course you will get issues of people not getting what they really need. In fact, when you take telemedicine, for example, what is a telemedicine consultation which is right and of good quality? Who should define that? Really, you need a regulator who would define that. If we say telemedicine consultation, this is what it constitutes. These are the parameters. These are the boundaries, and these are what need to be done. All this is government business. And in fact, these are things that initially the government need to do and disseminate it clearly to all the players that this is the rule. And every country need to have a regulator of these a regulator that is inclusive and flexible enough to allow other players also to play, and not only the government sector. And then also government going into partnership, like we've done in Ghana, for example, with a zipline, drone system, that this is a private company, but then the government has partnered with them to deliver essential medicine to very remote areas. This is an example, and there are clear regulations and policies around this. And I think that should be the role of the government in the country, that you are safeguarding the protection of the right of the citizens to care, and also ensuring that they are protected from exploitation, especially with the data aspect of it. Data protection and everything is sorted out. Over.
Thank you so much, Anthony. Really good points there. Protection of confidentiality, infrastructure, the government role. Let me come to you, Jan Willem. As Philips, you've worked with governments and NGOs and other private sector providers like AWS. And I heard Anthony saying that the private sector, can be viewed as seeing this as a profit issue. But how, in your view, how do you think these different sectors are connected? What are their strengths, and who should do what?
Yes, thank you very much. And the previous two speakers indeed said, the role of government is so important to provide a regulatory ecosystem, make sure that products are approved and provided access to the market that are trusted and curated, if you like, so that consumers and patients know what they can use and what they can trust. And there, of course, there's a lot out there already. I said earlier, copy and paste. But then when it comes to actually transforming a healthcare system, making it digital, it takes everyone. And what you've seen, we've had this experience not only in Africa, but also, for example, in the Netherlands or with Estonia, where the whole government would show up and say, look, we have no idea how to digitize this healthcare system. And to be honest, we don't have any idea either. But so you start to work in co-creation. I think that's also the point of the Digital Connected Care Coalition, and bringing together the various competences. Now, an AWS is a cloud provider, right? So they do that much better than we do as Philips. So we need to rely on AWS, or if you like, Google or Microsoft or any of those others. It's the government's choice or purpose to make sure that none of them takes a monopoly position. And that's what you see in Europe. They have developed a Gaia X model and the data spaces models whereby federated cloud infrastructure is defined so that you always have competition, that you always replace one cloud provider with the other. And then you go up to the stack, to the area where, for example, we sit as Philips. We believe in the platformization of healthcare data. That's our play. But there are a few other people out there that believe they can do that better than we can. And of course, you need to make sure, governments can make sure that there's competition between those. And then there's the application layer. So if you like the diabetes applications that Marilise was talking about, or if you want, somebody who's living with a chronic condition, hypertension and stuff like that, you want to make sure that you're using an application or a remote monitoring tool that's being approved by the government. But if the government doesn't like that one, they can replace it with another that is equally, proper quality of care. So there's these big cloud providers. There's the connectivity folks that need to provide the connectivity, because that's often a problem in Africa. Then you need the people that can integrate the data and provide services like authentication, design, or by compliance by design on privacy, data security, cybersecurity, interoperability, on all those kind of things. And then the application, sometimes the social entrepreneurs that can build applications on top of that. But let's make sure that when people build applications, it's interoperable, right? So can the applications talk to each other or not? I've seen so many clinics where you go to one portal to put in the HIV data for the patient, you go to the TB portal and you put in all the same data again in the same clinic. Yeah. How is that possible? Not designed for interoperability. And then what I think Marilise already said, the implementation or the change management is so critical. We don't have enough feet on the ground as Philips, or any social entrepreneur doesn't have enough feet on the ground. So you see a lot of the NGOs and the people that are in the communities that are so essential to make sure that stuff is trusted, starts with trust, and that the implementation is going with the same. 80% of IT implementation is change management. And if you don't do that consistently and repeatedly, not only just deliver the devices and the bundle and say, here's the application and the user manual, no, repeat, train over like a year or 2 years sometimes, only then do you have the sustainable transformation and the digitization of healthcare. That is the same in Africa as it is in the Netherlands, as it's in New York.
Yeah, thank you so much, Van Willem. And you bring some good points. So, Nitya, I want to come to you. We know that one of the big problems in advancing healthcare and also digital health is fragmentation, and Jan Willem has mentioned that as well. There are many pilots, many disjointed systems, unconnected programs. The question I want to ask you is, can insurers play a role in getting these systems connected? And how do they relate with governments, care providers, medtech and pharma, et cetera, to get this done?
Yeah, great question. And I wish I could answer that in its entirety. I hope I can, a bit of it. So on can insurers play a role? I think absolutely, because in my other hat, I run a Center of Excellence for Universal Healthcare for KPMG. So with my other hat on, I know that payer systems also need to evolve. And I've worked in many countries, including low and middle income countries, where payer systems are evolving. Now, absolutely, you need insurers who understand risk, who understand population health management, who understand how to close a network. But the insurer can bring that to the table. And of course, in the insurance world, there's a whole lot of digital transformation happening as well. So there's the claims engines. And in Bangladesh, we found that, we reduced the cost of the product we put out. By the way, it was only about $11 to $15 a head a year for a 24/7 access to healthcare, including insurance, hospital cash benefit, small bit of insurance in Bangladesh. But we were able to reduce the cost of all of that administration by creating a claims engine that was led by artificial intelligence, where fraud was recognized by visual recognition systems. So there's different ways that the insurance sector is going to play into this. However, just flipping it back, most insurers, big insurers, and I used to work for another one before this, are moving from what they call from a payer to a partner, so that the transaction doesn't remain fragmented between the consumer and the payer. And there's a lot to be learned from that, about that transactional nature of that conversation to stop. Because if you're looking at somebody remaining well, your book, you're insuring somebody, you want that insured person to remain healthy, and you don't want a huge claim at the end of it, then you're going to do something about it right at the start. And that's the kind of play that insurers are starting to get into. They're moving quickly into the service provision side of it, and you could call that it's not insurance anymore, but there are many people that are starting to, we certainly are. So we're looking at a product that we've designed for hypertension management, for example, in Thailand. There's going to be handed out to 50 million customers of a bank, of a large bank there, but we're using very digital means, and we're trying to meet consumers where they are. So a lot of us as entrepreneurs and as social entrepreneurs are trying to also meet consumers where they are. So there's a question in the chat about how do you reduce that kind of digital literacy? How do you stop that from the access and the digital divide getting deeper? We're going to do it online or WhatsApp, because that's where the consumers are. Because if you
Nitya, I'm going to ask you, I'm going to interrupt you, and there's a lot to say in a limited amount of time, but I'm going to ask you to respond to that question in the chat. Just because this is a session where we have a short amount of time. And I just want to, it seems like we all want to improve collaboration across the sector. So if I were to ask each one of you, what is the one question on the top of your list to ask the other government partners? So if you're government, what would you ask private sector? If you're private sector, what would you ask the World Bank, et cetera, et cetera? So let me ask you, Anthony, from your perspective, from the government perspective, what is one question you would ask any one of these panelists?
Well, I personally, I think that, it's more of the innovators. So the question is that, and that's always the question that I tell them that, look, it's better to look at, because sometimes they come with solutions in hand, trying to create the problem and apply the solution. And that, I think, is where they get it wrong. That there are already problems waiting to be solved. So interact with the government side and get the problem, and then develop solutions for the problem, rather than coming with the solution and trying to create the problem and fix it. So I think that is a question that I ask innovators. Why do they do that? Why do they come with solutions and try to create problem to solve when there
They're
are no
thinking
real.
way ahead. They're thinking way ahead of us, Anthony. Let me come to Jan Willem. What do you have to say about that as a private sector that has some solutions in hand?
Dr. Anthony, what's your problem? No, I think Dr. Anthony is absolutely right. And maybe my question is to the World Bank. I see a lot of good policies and good strategy papers. But when it comes to the implementation, it's really difficult because you can't, put your implementation into all those policy and strategy papers, which are often written by consultants. But when it comes to the implementation, it is really about convening and orchestrating the various parties around the table. And the governments often, especially in LMICs, often do not have the competences or the courage or the confidence to bring together the private sector, to Dr. Anthony's point, without being afraid that they're going to be sold something that they don't need. And so is there a role for a knowledge partner like the World Bank that has so many of donor countries in there that already gone through this, right? And convene this and hold hands, because digitization of healthcare is dangerous. We all know from wherever we live, large scale transformation, digital in whatever sector, could politically kill you, right? So to go for large scale is a danger in the Netherlands, it's a danger in Kenya, it's a danger in Thailand. Small scale is meaningless. So how do you give these big governments the confidence to bring together the right stakeholders to design a path to value and a path to UHC that is digital without people ripping each other's off?
Thank you, Jan Willem. I'm going to come to you, Marilies, because it seems that you are the convener as World Bank, and you have a knowledge partner. You are a knowledge partner. So from your perspective, what is one question you would ask any one of these partners that are on the call today?
I'm very tempted to answer Jan Willem's question, but I will pose my question instead. I do want to say, Jan Willem, I absolutely agree with you. I think we need more different kinds and robust evidence of how digital transformation really brings value, because we have to build trust amongst providers and amongst clients, right? And if we do not want in LMICs or in any context people to feel that a digital health solution is the second tier solution, right? That there's a first tier is go to a facility. If you can't, then you get the digital solution. So I do think this issue of trust is absolutely critical. Let me ask Niti about this issue of trust. How do you think we can best go about building trust amongst clients and consumers, those who currently access health services, but also build trust in a way that we will draw in people that don't currently have good health-seeking behavior? What is it that you think we can and should be doing different?
Thank you, Marilies, and I want you to think about it. Niti, you have exactly 1 minute to ask your question before we wrap up.
Okay, so my question would be to all three on the panel, as you would expect, is governments have a huge role. And my question to you, Anthony, is about that whole public-private partnership. I know the politics of PPPs are very difficult, but how does a government get beyond that? You have to get beyond that, because you're not going to be able to do, create health systems that are going to have all the provision in there. So that's a question to you. Marilies, to you, it is how World Bank is going to look at different financing instruments, and I know you already are, but what are the financing instruments by which digital health can be compensated fairly and properly? And to Jean, of course, my question is going to be, how are you going to partner with the likes of us? Because you were not known to be a services company. You were known to be a different kind of a company. How are you going to partner with the likes of us to create new products to take to market?
Thank you, Niti. You've asked everyone a question and you had one question to ask. So very, very interesting. I'm sorry, we have exactly 1 minute to wrap up our sessions, but thank you very much to our speakers. We talked about, people coming with solutions to government. Anthony, thank you so much for that question. World Bank, implementation. How do we leverage your convening capabilities? The private sector also coming in and working with government and other partners to leverage also your strength. And then the whole issue of value and trust has come up today. And so I really do thank you. We are at the top of the hour, and I want to thank all of our speakers very, very much for your participation. We still need more conversation around this. I do want our listeners to really know that this is just one of 3 sessions. So there is one additional session. The next session starts in 15 minutes on 3 country deep dives in digital health. And the other one happens, the third one is on December 2nd on digital health projects, learning and successes. So I encourage all of our participants to join us on the next session, which comes in 15 minutes, and then certainly on the session on December 2nd. And if you have any more questions that you want to know more about UHC 2030, the private sector constituency, and DCCC, please do see the chat and the slide that is currently on your screen on how to become a member. And many, many thanks for your attendance. Stay healthy to all. And thank you so much for joining us today. I wish we had more time to cover all the interesting topics. So thank you so much wherever you are. It was a pleasure to be here with you.
Thank you. Bye-bye.
Thanks. Bye.
Bye.
Bye-bye. Thanks, everyone.